My name is Ashley. Welcome to the Mini One gastrostomy tube replacement after accidental ejection in service. Today you will be learning about the Mini One balloon button gastrostomy tube, which I will also refer to as just a G-tube. You will also learn the complications of this G-tube and go through the steps of removal and insertion. As most of you know, the gastrostomy tube is placed to provide someone with adequate nutrition when they are unable to ingest food or fluid orally, that is by mouth. And when this tube becomes accidentally dislodged, it can be life-threatening, and we will go through some of the complications of removal later on in the video. So proper placement will provide our patients with better outcomes. And why is this class essential? Well, it's important to be educated on the why and the how of proper tube placement, which then gives you the power to provide quality and proper emergent care, and it also again increases the positive outcomes for Mini One patients. At the end of this session, I would hope you would be able to meet some specific learning objectives, such as knowing 3 ways of replacing a Mini One gastrostomy tube, knowing a combination of 6 complications of either tube injection or of tube placement that is incorrect. And you will also be demonstrating proper placement of the Mini One tube on a baby mannequin with the kit and equipment we provide for you. I know that dealing with a new gastrostomy tube for your child can be a very stressful situation, but it's extremely important for you to be able to take care of your child, as you are the first and best asset in your child's lifeline. You need to know that accidental removal is an emergent situation and that quick and correct placement is paramount. In this slide, you see the Mini One button balloon. To the left, at the top, the balloon port, the little blue area, that's where you'll insert your syringe to fill it with the normal saline and then deflate it. To the right of that is a small white area towards the middle of the shaft, and that is the feeding port, and you can see how it's closed off at this point. And then at the very bottom we see the balloon, and it is inflated, and this is how it would look on the inside of the child's stomach. This slide shows the items that you would find in the Mini One button kit. It will come closed and sterile in a tray. Your kit should also contain some water-soluble lubricant and gloves. If not, these are items that you would definitely want to have on hand as they are necessary. The syringe to the left in the middle, the slip tip syringe, this is the one that will be filled with normal saline for inflating and deflating the balloon. So now we move on to ways to reinsert the Mini One G-tube button after it has been accidentally ejected. The first would be to put it right back in. This can be difficult, of course, if it was pulled out and the balloon is still intact. And if you could quickly get the balloon deflated, you could try to reinsert it. The next would be to use the same size of a brand new tube and go through the process of opening the kit. And the next would be to use a smaller size if the same size tube was unable to be reinserted. And the fourth would be to use a Foley catheter tube, and that's usually going to be a smaller tube than the G-tube, and it may seem odd, but it does keep the stoma patent, and it does allow for the patient to have nutrition. As I had stated earlier, the complications of tube ejection can be life-threatening. It could also simply cause the stoma to close, and this can happen within minutes. Sometimes it can take hours or days, but the less mature a stoma is, which means the younger it is, so under 30 days usually, is more difficult to reinsert because the stoma can close quicker. A more mature stoma gives you more time, can even give you hours to get it in. And obviously with an ejected tube, there are altered nutritional intake because you are no longer able to provide them food and fluids. They are also at risk for infection, such as peritonitis, which is in the abdominal cavity. They could have a gastric perforation, which is poking a hole in the stomach other than where the stoma is. You can also have gastric ulceration, which is a sore in the stomach lining, and I've included a little visual for that here at the bottom. There are also complications of improper placement of the G-tube. These can be simply just pain at the stoma, and even though the G-tube may be patent, it just might be the trauma from ripping a G-tube out and then reinserting one. The child can be very irritable and restless. You could have some gastric leakage, which means some of the contents from the stomach are coming out onto the skin. You may have altered vital signs, such as increased respirations, temperature, heart rate, blood pressure. So you'd want to check those after you did either the displacement or the replacement. And they can also aspirate. And aspiration is when you take something other than air into your lungs, such as liquids, food, and that can be one of the most serious complications, can often cause pneumonia, and it can be fatal at times. Although this class is about replacing the Mini One button G-tube after accidental removal, I do believe it is important for you to understand how to properly remove the G-tube in circumstances which it may not be completely ejected, such as slightly pulled out, or if there is the balloon's not all the way deflated, but you know it's not where it's supposed to be. So knowing the proper steps for removal is extremely important. So we start by removing the Mini One button, lubricating the stoma on the outside with a water-soluble gel. And anytime you lubricate the stoma, you want to use water-soluble gel. Then you will acquire a Lurlock syringe that you were shown previously and use that to completely deflate the balloon, noting how much fluid has come out of the balloon. And then you'll want to gently, slowly, and steadily remove the old tube from the stoma. To begin the process of inserting your new Mini One button gastrostomy tube, you will first acquire a new kit. You'll want to inspect it all around and make sure it's not damaged or previously been open. If it does come with gloves, you would then open the kit and don your gloves. If not, this is the time to put some on. You would then open the kit and inspect all of its contents and make sure that none of it is damaged. You'll want to check the balloon integrity, and you would do that by inflating the balloon with the provided pre-filled syringe of normal saline and then deflate it. You will then lubricate the new tube, and you may use the obturator, which also is called a stylus, which is highly recommended, as that is a firmer tool than the very soft and flexible button. Then you would again lubricate the stoma And both of these lubrications would have to be a water-soluble gel, such as these commonly known brand on the right, such as KY. But you may also use a generic from any store. Next, you will gently guide the tube into the stoma. You would then remove the obturator or the stylus and hold the tube in place with one of your hands. Then you would use your other hand to grab the syringe and inflate the balloon. After inflation, remove the syringe and then gently tug on the tube to validate that it is secure and placed. You then proceed to cleaning the stoma site and the button if it acquired any gastric contents or if there's too much lubrication. You could then apply a dressing as it has been ordered. Sometimes you may not have one. You would also verify placement by aspirating gastric contents. And you do that by connecting the extension tubing and using your large syringe to pull out what should be gastric contents. You can also use a pH test if that's available. It's like a litmus paper that may or may not be provided with a kit, and you can also purchase them on your own. And I know now you're completely exhausted, but don't worry, I'm sure you did a great job. I would now like you to watch a couple of instructional videos regarding the Mini-One balloon button gastrostomy tube. It is a little more in-depth than just removal and reinsertion, but it does give you a little more background specifically with this tube by the company that makes it and provides it. And also there's a third link for the brochure. It's the patient education. And that is for your knowledge only, but it may also help in our class. Just remember, you're doing this to be informed of the proper way to care for the G-tube in an emergency situation, and this will make you ready to do so and to make you the most effective provider for your child. You are their first line of defense, just like 911. But again, if there are any issues or problems, please call your doctor or 911 immediately. Before you get to your post-test and to your demonstration, let's do a quick review. So what does a gastrostomy tube provide a patient? A G-tube provides patient with adequate nutritional intake. Some children are unable to take breast milk liquids or solid food orally for any number of reasons, and a gastrostomy tube is a great alternative to maintain their proper caloric and fluid consumption. What is aspiration? Aspiration is when something other than air is inhaled into the lungs, such as water or food. It's very serious, and sometimes it's a fatal complication of improper tube placement. It may also happen when a person vomits. If you suspect your child may have aspirated, definitely call your doctor immediately or go to the ER if they're showing any signs and symptoms of distress. How much saline do you use to fill a Mini-One balloon button? The exact amount the doctor has prescribed is the correct answer. The button balloon does have a maximum and a minimum amount of fluid it can hold suggested by the manufacturer, but the doctor will decide what he thinks is sufficient for each individual patient. If the amount prescribed is more or less than what the package suggests, you may call your doctor to confirm. Or if the tube seems to be too tight or too loose after balloon inflation, you may also call your doctor and let him know. These are the references I used for my project. I thank you for your participation in this in-service. And now, does anyone have any questions?